have poor drainage from your sinuses, then that's where the venous plexus is coagulates, and then so it kind of backs up. So the optimal time to spray your nose is before you go to bed, because you need to be able to breathe through your nose for proper drainage. There's a gas in your cheekbones called nitric oxide, and every nasal breath brings this nitric oxide into your lungs. And nitric oxide's purpose is to prevent you against respiratory infections. So it is an antimicrobial. It kills viruses, bacteria, and fungus. And it also is what we call a peripheral vasodilator. So it makes the vessels in your periphery, in your hands, and your feet, and everywhere else, open, so that it lowers your blood pressure. So by breathing through your nose properly, you will have many more sustained health components. And the things that we look at, and the things that we notice, like you notice the bags or the darkenings, those are all
puffiness,
signs of things that aren't proper.
And I think that we don't realize how, anyone out there, this clear nasal product is kind of miraculous. It really is. It's made with xylitol, which we talk about xylitol and the importance of xylitol, and it's with regards to the biofilm, and the plaque. And this is like we don't realize how important our mouth really, it changes everything for the body and in every way. It really does.
Yeah, well, the mouth, the face, is basically the representation of what is right or wrong with your body. So that's going to be some of the first presentations of where symptoms occur. So many of the things that we get treated for in the mouth are what we call systemic. They're throughout the body, but they're manifest in the mouth. So the gum disease and the cavities and all these kinds of things, very often these are breathing-related problems from people that have to breathe through their mouth, which is abnormal, instead of through their nose. So that's why it's all important. It's ironic. I'm sitting here taking a break from writing a paper on. We did a study. We're currently doing it with a number of our centers, where we take a baseline of people's nasal volumes, all these patients that come to us with these problems, and then we spray their nose with clear, and which is, as you say, saline and xylitol. And xylitol has so many beneficial properties in its ability to kill bacteria and other viruses and this sort of thing, but also shrink tissue, increase function, and it's so helpful for a lot of the acute ear infections and problems that people have with breathing disorders. So it's key to, and even things like grinding your teeth and things like that, very much related to nasal obstruction, breathing. So, looking, the things that are not right in your mouth and your face. I always say the face is like the monitor of your body. I treat chronic pain, so people are constantly in our office because their face hurts and their jaw. Well, that's usually secondary to the aches and pains they have throughout their body, and or very often, in addition to breathing disorders. So that's why our name is TMJ and sleep therapy, is because those two things are intimately related. People that have problems with their jaw and their face very often have a breathing disorder.
Can you explain to us a little bit about what TMD stands for, though?
Yeah, TMD is temporomandibular disorder. So that's kind of a collection of a number of symptoms. The T is temporal. That's the bone on the side of your head where your ear is attached. And the mandible is your lower jaw. So where your lower jaw articulates with your skull, that joint is called the temporomandibular joint. So a problem with that joint would be called TMD. But that's a very broad term, and it's a very poor term. People say, oh, you've got these TMJ issues. Well, that's often the symptom. So that would be like the fever of a disease. So if someone's saying you've got a TMJ problem, and we're just saying that, well, you've got a fever. Okay, well, great. Well, what's making that is always my question. And so really,
I love that.
A better term is craniofacial pain. And that's why the academy that I'm president of now is, has that terminology. And in other words, anything that hurts in your face and your head is what we treat. And the jaw is just one of those things. But breathing is a big factor, and that's how I came to the whole thought process of breathing, was from treating people in chronic pain, because years and years ago we didn't know all the things we do about breathing. This is a kind of a new concept, that people have to breathe, in medicine and dentistry. We weren't taught these things in dental school.
Yeah, this is a whole new field, by the way. This is a very exciting time, and I remember I was at the conference that Clear did several years ago in Cancun, and it was an amazing conference for me because I saw slides, pictures of young kids that were mouth breathers, and then pictures of them before they were mouth breathers, and the difference in the face and the shape of the face was absolutely mind-blowing.
Right. Well, that's why people...
I had no idea. Yeah,
absolutely. It changes the skeletal structure, the muscles that attach to the bone change how you grow, and those mouth-breathing children become mouth-breathing adults, and so those kinds of skeletal changes, those orthopedic changes, are the things that end up causing the jaw to dislocate and cause all these other issues that people term, TMJ or TMD.
Right. So this is an area that we just are exploring in the last decade or so. It's rather new, but we really do not understand the ramifications of mouth breathing and the effect on our sleep, and we really don't get, as a country, how sleep is so critical to our very own health. You're teaching other dentists now.
Yes, I've been educating, in many parts of the world. So regularly throughout the U.S. For the last 15 years, Canada, Australia, Middle East, Europe, UK. That's where we have our centers. We have, as I've educated dentists, then they've been interested in being able to treat patients in the same way I do. I stopped doing traditional dentistry about 20 years ago, and then devoted my time to helping patients in just these limited fields. And so as I go around and explain these techniques, dentists often want to do the same. And so we personally mentored each of these doctors in these different locales. And as a result, we now have a international system for data collection, and now we collaborate with many universities to do research projects. And so it's very exciting to be on the front end of the development of these problems that afflict so many people.
Very exciting. Tell us why you love this clear nasal spray and why it works.
It's as I was saying, we're publishing a study on exactly quantifying how well it works. We've known that the combination of xylitol and saline has been very effective in many applications for people with chronic ear problems, respiratory problems, and things like that. And certainly we've been using it in dental dentifrices, toothpaste, mouthwash, all this, because it prevents cavities through its antimicrobial properties. But we really wanted to measure how well it opens up the airway. And so we have special machines called EchoVision, where it's basically like a sonar, and we can measure the volume of the nose or the throat. And so we're currently publishing a study demonstrating that we're getting significant opening of the airway after the spray. And in combination with the xylitol, see, the saline and xylitol combination that's been used head-to-head against decongestants like Afrin, and has been found to be more effective. So, and it's so much safer. See, the problem I have in trying to manage all these breathing problems is that people will often use over-the-counter products and make their condition worse. So we get rebound where we have products like antihistamines or decongestants, or sometimes steroids. And so what happens is people will take the products that they buy over the counter. It'll be effective for maybe a few days, but then an antihistamine or decongestant will actually make the situation worse. Whereas using saline and xylitol, which are all natural, we never have that issue. And so people can use it throughout the day, repeatedly before bed, as you were mentioning, and do it day after day without any harm. And that has been a godsend, because in chronic pain people, we have a lot of real sensitive people, and so we have to be very careful what we introduce to them. And so something like this has just helped tremendously, because most of my patients, I have to say, that have facial pain problems have nasal obstruction issues. So there is absolutely, I can't think of a patient that we don't have using this product. And I'm not talking in my practice in San Diego. I'm talking about the other 50 practices we have throughout the world. Everywhere I teach, everywhere I go, I explain the nose is the reason why so many of our patients' faces hurt, and it's not being managed. That's why people have not had good success. They'll get night guards and things, but they don't understand that grinding your teeth is the symptom. It's not the origin problem, and it's the inability to breathe through the nose, where the mouth has to open, and the muscles get tired from holding your mouth open. It is not normal, and that's why people have so many facial pain problems. So, and then you have the situation where people have obstructive sleep apnea, and in this situation, the throat closes. And what we're seeing now on the current literature with ear, nose, and throat docs is that nasal surgery, improving the nose function, actually helps to reduce obstructive sleep apnea. In one case, Dr. Catalano from Boston University is showing us, we had a sleep conference there at BU just a few months ago, where I was lecturing with him, and he was showing his paper that he's going to publish that showed a 50% reduction in the amount of suffocation that people have with obstructive sleep apnea when their nose is properly repaired. So managing the nose is huge for us, and basically the nose is lined with erectile tissue, so whatever the person comes in contact with that irritates their body, their nose is one of the first places that swells and blocks, and that's where we start the mouth breathing problem. So that's why diet and everything else need to be addressed as well.
So fascinating, Doctor. We have a question from one of our listeners. She wants to know, what type of dentist do you recommend for people to go to?
Well,
are there any in Boston?
Oh, absolutely. Actually, if you visit our website, tmjtherapycenter.com, center is spelled CENTRE, you'll see a doctor directory, and you'll find that we have one there in Boston. So I think that we're trying to pan out to every, I'd love to see a facility in every city in the world, and that's certainly our goal. Dr. Amparo David is our center doctor in Boston, so I suggest you go on the website and you can find out more information about our centers and be able to be helped locally.
Say his name again, please.
Amparo David.
Okay, thank you.
Mm-hmm.
I just want to also remind people that clear nasal is now available at CVS, Rite Aid, Walmart. It's unbelievable what's happening with this product.
Right.
So it's very exciting, as well as Whole Foods and Sprouts and Vitamin Shops.
Yeah, because the availability is so important, because it's a real necessity, and we have to be careful of products that can be harmful. Flonase now is very commonly used steroid over the counter. And we have to be careful with that. Dr. Canalano was talking about the fact that the high circulating levels of steroids in the bloodstream when you spray it in your nose, particularly Flonase, can arrest growth plate growth in children. So that to me is a bit terrifying, because these are products that can be got at Costco and things like that. Whereas products like Clear, can, as you mentioned, can be purchased at all these facilities, and it's such a much safer product. So I think we have to be careful what we put in our body, and certainly what we put up our nose.
Oh, absolutely. For people that have severe sinus problems as well, Clear could be this could be a wonderful product.
Yeah, there's many delivery systems. There's just the pump spray that is probably most commonly used. But sometimes people have had surgeries to improve the situation, but sometimes the surgeries actually make situations worse. And sometimes people have had actually increased problems after their surgery. So it all depends on the type of surgery and what indications are, and certainly what kinds of other health concerns people have. But irrigating the nose with the Clear product. A neti pot is a technique. It's a little plastic applicator. The packages, individual packages of the Clear can be mixed with water, and then they're placed in that, and then that is used to flush out the nose. So this can be really helpful on a daily management for people with chronic problems.
Doctor, thank you so much for being with us. Give us the website, your website.
It's TMJ Therapy, CHERAPY, Center, CENTRE.com.
And for more information, go to clearxlear.com. Thank you, Doctor. We'll be right back. This is Frankie Boyer, WCRN 830 AM on the dial.